starting 2 years ago this month. If you had cancer or a chronic condition of some kind that made it hard for you to get health insurance because you had a pre-existing condition, starting 2 years ago this month, you finally got some help in the United States of America. They set up these new high-risk insurance pools that you could get into at a reasonable cost, even if you had a pre-existing condition. That was new, and that was July a couple of years ago. By September that same year, for the first time, it became illegal for insurance companies in this country to refuse to cover a child on the basis of that child having a pre-existing condition. And by September that same year, September 2010, young people were allowed to stay on their parents' insurance plans until age 26. That was also brand new, starting 2 years ago in September. In September of 2010, it also became illegal for your insurance company to drop you, to cancel your coverage, because you had the audacity to actually try to use your insurance because you filed a claim. Starting that same month, your insurance company stopped being able to put a lifetime limit on you in terms of what they would spend on you for your health care needs. So if you get really sick, your insurance company no longer gets to say, too bad, we know you paid for this coverage and everything, but we think we've spent enough money on you and your illness already, so die already, you're on your own. Also, starting in September 2010, it became a new rule that if you were paying for health insurance in this country, that insurance has to cover some preventive services like mammograms and colonoscopies without charging you extra for those services. If you have insurance, those life-saving and, frankly, money-saving things are covered without you having to pay extra in the form of a copayment or a deductible. That all happened in 2010, within months of health reform passing Congress and being signed into law by President Obama. Then, last year, improvements to Medicare, so seniors would start getting free preventive health care through Medicare. And last year, insurance companies, for the first time, were required to spend 80 to 85% of your money, of the money that you pay them in premiums, on your health care instead of on marketing or CEO bonuses or whatever. If they don't spend 80 to 85% of what you pay them in premiums on actual health care, they have to refund you. They have to pay you back. That part of the health reform law took effect last year, which means that right now, this year, millions of people and businesses are starting to get checks in the mail from their health insurance companies because the insurance company did not, in fact, spend enough of their money on their health care, so people are getting a refund. Insurance companies are paying out over $1 billion in refund checks this year because they didn't spend enough of what you paid them in premiums on actual health care. Starting a few months from now, on January 1st, there's also going to be expanded preventive health care for people on Medicaid. And there will be higher payments to primary care doctors who treat people on Medicaid. And by the year after that, January 1st, 2014, for the first time, it will be illegal for insurance companies to deny coverage to anyone, not just kids, but anyone with a pre-existing medical condition. It will also be illegal for insurance companies to charge women more for health insurance just because they're women. And beyond just the lifetime caps on your coverage, insurance companies will also then not be allowed to set a yearly cap, a year-to-year cap on what they are willing to spend on your health care. And that's the evil Obamacare. Sounds awful, right? Evil health reform. Doesn't it sound terrifying, like it's going to reach out and grab your ankles when you get out of bed in the morning? That's what Republicans keep voting to repeal. That's what Mitt Romney says he will definitely get rid of starting day one if you vote for him for president. But, you know, there's another piece of health reform that goes into effect tomorrow. Starting tomorrow, August 1st, if you have health insurance, you will be able to get for free, under your insurance, a whole bunch of preventive care designed to help women. Starting tomorrow, new and renewed health plans are required to cover, without copayments or deductibles or anything, required to cover a whole host of preventive care for women, from pap smears to detect cervical cancer, to STD screenings, to other kinds of cancer screenings, to gestational diabetes testing if you're pregnant, to breastfeeding supplies if you're a new mom, to, of course, the star of this year's loudest and longest, I can't believe it's the 21st century controversy, yes, birth control, covered without a copayment and without a deductible. And so today, on the eve, literally the eve, it starts tomorrow, the eve of this new wave of free preventive coverage for American women that starts up under the health reform law, Democrats have been doing a bit of a victory lap. Democrats today talking up not just the new stuff that takes effect tomorrow, but all of the life-saving preventive coverage that insurance companies are now required to provide for women thanks to health reform.
During the health care debate, we wanted to do two things. We wanted to be able to save lives and save money. One of the most important tools we women have is mammograms. But in the midst of the health care debate, they wanted to take our mammograms away from us. Well, hey, not while I'm here.
Senator Barbara Mikulski of Maryland speaking today at a Democratic press conference about what women, frankly, are going to be able to get now thanks to health reform and thanks to the fight that it took Democrats to get it passed with 0 Republican votes. I also want you to watch this. I don't think this has been picked up anywhere else today, at least that I know of. But this is Senator Tom Harkin of Iowa also speaking today, and I think this was remarkable. This is him talking about this in really, really personal terms. Watch.
I lost both my sisters to breast cancer, my only 2 sisters, at a fairly young age. When my older sister, Marianne, died and we went to her funeral, her younger sister, Sylvia, was there and had no idea that she also had breast cancer. Within 2 years, she was dead also. And they left young families. They lived in rural areas, small towns. They didn't have any money. They didn't really have health care coverage. For them to go to get a checkup would have cost money. Money that they could ill afford at that time. They had a number of kids. And as I said, they didn't have a lot of money. They didn't have health care benefits. I often think, what would have been different if they could have had this available to them? Early checkups, early screenings. But for both of them, it was way too late by the time they discovered it. So this has a very personal, poignant meaning to me. And I just hope that women in this country now will take advantage of this and will now go and get those annual screenings and get those checkups. Early detection we know works, and millions of lives can be saved. And as Senator Mikulski said, families will not have to lose a parent or a sister because of breast cancer or cervical cancer, all the others. So when I hear Republicans say, and they still say, that they want to repeal this, and they want to take this away from women, I stand with Senator Mikulski. Not as long as we're here.
Senator Tom Harkin of Iowa speaking today about the kinds of cancer screenings and preventive care that health insurance companies, as of tomorrow, are required to provide to American women at no cost, saying it's the kind of care that could have saved his own 2 sisters' lives. That's what Democrats were talking about today, about the benefits that women are getting starting tomorrow thanks to health reform, the benefits they are about to get thanks to the Democratic fight for health reform, which Republicans opposed. And so naturally today, on the eve of those new benefits kicking in for women, Senate Republicans again tried to repeal health reform.
I think, given the fact that our friends on the other side are going to focus on that bill this particular week, it might be a good idea to have a vote on it, because I think it would be appropriate to have a vote on the repeal of Obamacare.
Republican Senate Leader Mitch McConnell asking today, on the eve of all these brand new women's health benefits kicking in, on that occasion, specifically for that occasion, calling for a vote to repeal the law that made those benefits possible. The Republicans' proposal did not go over well in the Senate today.
I am stunned that on the eve of the broadest increase in benefits in my lifetime, the Republicans want to repeal these benefits from women. This is a continuation on their part of the war on women. And they can get up and stand on their head and deny it and everything else. How else can you explain why on the eve of the day that the women are going to get all these benefits, they want to now cancel Obamacare and stop all this from happening?
You know, every senator has to decide what they are going to do that day when they wake up in the morning. And for some in this chamber, they wake up every day thinking about how they're going to stop President Obama, how they're going to stop his agenda, and how they're going to do everything they can to stop him from having a second term. People will come to this floor and they'll pound their chest and complain about their president. We want to pound the table and make sure that women have gotten the health care they need.
Senators Barbara Mikulski and Barbara Boxer. So on the Senate side, the Republicans picked the fact that tens of millions of American women are about to get access to free cancer screenings tomorrow as the occasion to try to stop that from happening. That's how it happened in the Senate today. You saw the reaction from the Democrats in the Senate. On the House side, Republicans picked that same occasion, that same day in Congress today. What do you think? Jobs, jobs, jobs? No, of course not. They're voting on yet another new federal anti-abortion bill today. Because there isn't anything else to work on, House Republicans today voted on a new abortion ban, specifically for Washington, D.C., a new ban that breaks new ground even for these Republicans by making sure that rape victims and incest victims are not exempted from the new ban. So if a rapist impregnates you in the District of Columbia, the Republicans' new law could ensure that even you are forced by the government to complete the pregnancy that is the result of the rape and give birth to the rapist's child against your will, if the pregnancy falls within new, narrowly defined parameters narrowly defined by House Republicans. 222 co-sponsors for the Republicans' Let's Specifically Punish the Rape Victims and Incest Victims new D.C. abortion ban bill. 222. Because of the way the Republicans brought up their anti-rape victim and incest victims anti-abortion bill today, they needed a two-thirds majority for it to pass. They did not get that two-thirds majority, and it did not pass. But voting on yet another anti-abortion bill is the way Republicans in Congress today celebrated the fact that women all across the country tomorrow are going to get new free access to reproductive health care and cancer screenings and contraception and even breastfeeding supplies for new moms, thanks to the health reform law passed by the Democrats that the Republicans are still trying to get rid of. How's that gender gap looking for the election in November? Even Republicans in Congress are complaining about how this looks for them. Ahead of today's vote, anonymous Republicans talked to BuzzFeed's John Stanton about what bad messaging they thought this all was. Quote, leadership told us that the get out of town week messaging was stop the tax hike. It baffles many of us that they would muddy that messaging by scheduling an abortion bill vote. Quote, Obama raising taxes is supposed to be the message of the week, not this. You know, for a while there, the Republicans actually did have their messaging sort of under control. Even while they were constantly working on anti-abortion legislation, they weren't talking about it. They were at least talking about jobs, jobs, jobs and tax cuts. But now, kablooey, it has blown up. This week, the Republicans who are the ones talking about jobs and tax cuts are the ones whispering and complaining anonymously to the press. While it's the Republican leader of the United States Senate trying to schedule a vote to repeal women's health benefits, and in the House, they actually did hold a floor vote on Congress forcing rape victims and incest victims to give birth against their will because Republicans in Congress say they should.